Emer. We're in West Hollywood, end of the week, and we're doing an acne scar treatment today, and I like to show people this. This is called Cannula Subcision. Myself and Devin Lim kind of started doing this not too long ago to limit trauma to the tissue while also being able to break apart adhesions. So you can see here my cannula is under the skin. He's got some numbing in here. He also has a little filler under the scars. And what I'm trying to do is literally go scraping right under the dermis and or the fat layer, breaking apart any adhesions that he has from scarring. And we can work our way around. This is one component of acne scarring that helps lift tethered scars, but it's not going to treat all the components of the scarring, such as volume loss and textural issues, which require TCA cross and lasers or microneedling radiofrequency. You can see here I'm pressing, he's got this tethered adhesion right there. So we're going to break through that. Sometimes you have to grab the tissue, kind of squeeze through, scrape that, get rid of that. You okay?
Yeah, thanks.
Good. So you have a little more numbing in, just a small amount.
Yeah.
Good. And that's the key, is breaking through. There we go. You can hear it if you listen. Come close enough, don't talk. A little scraping right under the surface. A lot of people believe that that produces collagen, and besides just lifting the adhesion, helps overall the scarring. In the past, we used to do this with a no-core needle or something very, very strong with a blade, which caused a lot of hematomas and downtime. And we found that, Devin and I found that changing to a cannula gives you almost the same result without the need of all that issue. Perfect. So now, almost no bleeding. We're really able to move through the tissue relatively easily. Good. Now to keep the adhesions from coming back and allow us to get a better textural improvement, and if you notice, you also get a massage when you come to my practice by our PA. When doing this, breaking those adhesions apart, the next step would be to add a little filler. Now we already did superficially, so I can get some textural improvements in his skin. Now I'm gonna let that sit. We're gonna go grab some of the filler, and we now are gonna use the Bellafill, which is the polymethyl methacrylate beads. We call this the Spiderweb Filler because look, it attaches to itself just like a spider web. These beads go under the skin. You can see them right here. They're actually crunchy with a collagen carrier in there. They go under the skin, and we're gonna go a little deeper this time into some of the bigger scars that he had to give support, because we don't want the adhesions that we just broke apart to come back. So, and then I already know he has a little bit that we need for overall volume, so we're gonna go a little deeper just to give a little lifting. But you can see this even has more bleeding than the procedure itself. Okay, so now we're gonna hold right there. We're gonna put that back. We're gonna turn to the left. I'm gonna show you guys this side. So you see here, hold, do me a favor, with this hand, let's hold right there, lightly, good. And you can see now where he has all these textural issues. Our goal here is to break these apart, and then we're gonna put filler in there. So we make one little poke, turn all the way left for me, okay? Good. Plus, thank you. And hold on, sometimes you get a little vein. Hold still. This is the reality. You're gonna wanna switch spots. That's why you have the covers here. Good, all right, hold on. Give me that again, little needle. Go to a different spot. That spot's not gonna be the spot we want.
Can you use numbing with this?
Yeah, we're gonna do numbing. We're gonna do one poke here, a little pinch. That he'll feel. You're gonna hold here for me, okay? one sec. Good. Good, and you see how there's no bleeding there. We go right under the skin, and he would feel this normally. He's feeling that a little bit now. We go right in there and just put a little bit of numbing.
Oh, yeah.
Small bit of numbing. Move back, and again, you can see now how rough this side's very thick. So we're going right up on that surface, a little bit more numbing. There we go. Doing good. Deep breathing. A little bit more numbing. There we go. Look over there 1 second here. Got it. And then last little bit. Hold on. This area wants to bleed. That can happen. It's normal. Go right under the skin. Add a little bit more numbing. There we go. And now I try to do the least amount of numbing possible. So I'm going to ask him, how are you? Are you okay right now, or is it too painful?
It's not too painful, but I can.
You can feel it a little
I can
bit.
feel it,
If
definitely.
you can tolerate it, let's keep it at that, okay? Because if it gets too intolerable, you tell me, because the less fluid, the better, okay? We want to be able to see all the scars. But you can see, look how quickly we were able to break apart those adhesions. It's scraping right on the dermis, and we're really getting a lot of those scars. I mean, look at, it's moving through very easily.
If you wanted to follow up with lasers, could you do that?
Do it on the same day. We can do lasers on the same day, or you can do it in a few weeks. Today we're just doing the subcision and filler. But he does need lasers. We have a combination treatment plan ready for him. We're doing the subcision and the filler today for the deeper scars. We're gonna see how that builds. He's gonna start microneedling, radiofrequency, and some Fraxel. You know, we need to pre-treat his skin with skin care, just to prevent, because of his background ethnicity, we don't want hyperpigmentation or issues with any energy devices. Hold on. So right there.
How long until you see results?
Well, he should be able to see results within a few weeks. And collagen builds over time with the Bellafill, a little more numbing, so I can go to the lateral portion. See all the bleeding stops, just superficial veins, no big deal. But we need to go a little more laterally. So we're going to take one last bit, go back to this spot over here. Okay, go ahead and grab there. We'll see if there's any more squirting or not. Hopefully not. Wonderful. Go right in there. Just do a teeny bit of numbing, very little. Good. And we go. So now we're going to move at a different angle. Really focus on breaking out those scars. Look, right on the surface. Look at that. It's like a fish underwater, right there. Breaking through.
How long does the healing process take?
Depends on the person. I mean, technically, you're going to be swollen for probably a few weeks, but within a few days, it should look better. There we go. Okay.
Are there specific products you should be using after?
Yes, and he's got a whole protocol for products. For subcision, since we're under the skin, there's really nothing but preparing him for lasers, vitamin C, kojic acid, glycolic cream, hydroquinone, and retinol are the most essential. Perfect. Okay, so hold right there. Now we have that little bit of Bellafill left over. Remember beforehand, go ahead and let go. I showed you guys those markings of the deeper scars. So we're now going to place some filler into those previous markings to keep the subcision elevated. Well, he does need some overall volumization. We did that on the other side, so we just do that small bit right there. Hold right there, and he's good. So that's subcision and filler. It's the start of the process. It's not going to completely improve everything. And remember, the Bellafill is going to build over time. Probably need to do this a few times, and then some lasers, and he'll get a big improvement. Stay tuned. Good job. You okay?